This is Dr. Nicholas Rizzo from ringsidemedicine.com with cases from Ringside Medicine. Oh, that surgery. On the pre-bout history form, a fighter checked off the box next to no surgeries. On the pre-bout history interview, though, the physician asked if he had ever had any eye surgeries and admitted to Lasik, stating, "I didn't think of that as a surgery." This raises the issue of Lasik versus PRK in professional fighters. Lasik has a significant risk to it, specifically as it relates to flap disruption. So if you look at the diagram on the left, you can see the microkeratome cut, where a fine blade in the past, now replaced by a high-technology laser, creates a cut and then a flap, which is hinged. A laser beam ablates part of the cornea and the flap is held in place without sutures. The problem with the flap is that the cornea is avascular and this flap never completely heals, and there are actually reports of surgeons being able to tease this up gently intraoperatively later on in years. To the right is a diagram of PRK where there is no flap in the creation of the refractive correction. Additionally, with PRK, there's a decreased chance of globe rupture relative to Lasik, as the cornea is not thinned in the same manner. This next slide illustrates two complications of Lasik flaps. The left is a late flap dehiscence due to trauma, which is a rare complication and suggests that the interface between the flap and stromal bed is a potential zone of weakness for many years after the procedure. The picture to the right shows a traumatic flap disruption. There have been several reports of traumatic flap disruption in sports, although none have yet been reported in boxing or MMA, but many clinicians feel this is simply a matter of time. PRK is the preferred procedure for fighters. In most jurisdictions, Lasik does not preclude someone from fighting, but in some states, Lasik does prohibit a fighter from fighting. Increasingly so, many states are adopting the same stance of prohibiting Lasik. As fight physicians, it is our duty to ask the fighters if they have had any eye surgeries, and in the case of Lasik, educate the fighters about the risk of flap disruption. If a fighter that has Lasik is cleared to fight, and does so before the fight, it is important for the physician to instruct the fighter that in the case of any eye trauma, blurring, or other concerns, such as change in vision, then he will likely be immediately transported to the hospital for full evaluation with the intent of saving the Lasik flap. Additionally, this case illustrates the importance of not going simply by what the fighter filled out in the form, but how imperative it is to actually have a verbal interview at the time of the pre-bout evaluation. Thank you for watching this presentation. This and other presentations are available at ringsidemedicine.com.